little different perspective. So as healthcare architects, we are very, very interested in this intersection of technology and what we think about in terms of the humanity in architecture, in healthcare and in health. And as architects, healthcare architects, sure, we know everything about the codes, the safety that we have to do, making sure the program works, yes, the technology, lighting, sound, furniture, equipment, making sure everything's quite right. And of course, to make it beautiful. But more now, we are focused on the human experience of those that are within our buildings and facilities. The number one thing, be it a patient, family, clinician, staff, and the community. And this experience is critical for what we do. Now, we've all had an experience, and we heard one earlier, and I'm going to share one with you. This is my mother, about 5 years ago, and she had a neurological event where she ended up at her academic medical center, community hospital, in a neurointensive care unit. Didn't quite look like this, but pretty close. Very cluttered. There's a little window on the left that you can't see, a lot of equipment, but the real treat was it was above the ambulance bay where all the trauma cases came in. And yes, not this loud, but it was loud. And we heard it, she heard it, the clinicians heard it, and I'm sure it was a problem for them too. Where it could have been like this. This is a neurointensive care unit at Massachusetts General Hospital. Thoughtfully thought about with them in terms of where all the equipment and technology goes. Great storage along one side. Wonderful view out into a healthy and healing environment. This is what we're thinking about in terms of designing for technology. Now, we know that a lot of technology in healthcare medical equipment is pretty big, pretty imposing, like this Zigo room, and we do what we can do to make it be a safe and great environment so that clinicians can work at the highest level of their license. But technology right now is doing some interesting things. There was an anesthesia machine in that room. This is some of the latest technology of an AI overlay on an anesthesia machine. Not too beautiful right now, kind of all over the place. We're finding ourselves as designers having to really think about and design for the future of such accomplishments in technology. So we can get that. We'll understand that in terms of facilities, but we think that there is a greater opportunity in terms of thinking about and asking the question, can technology help us to be more human in our health and healthcare environments? And we think that it can, but it's going to require a couple more experts. We work with a neuroscientist called John Medina. He's from the University of Washington, and he's focused on the impact of environment in healthcare. And we think this is going to give us a clue about thinking about this integration of technology. What he has taught us to think about is the importance of light in terms of healing, the importance of nature and how sounds of nature impact the way we get well and the way we think about our health. The diversity of environments, not only those that are close that enable us to feel safe, but a prospect that enables us to have a view and put ourselves elsewhere. To think about nostalgia and what that does to us as patients and clinicians in our environment. Rest, how important. We know this from a lot of our corporate clients who get that it allows us to be higher in our performance. Noise levels and the impact in terms of how we think, and how exercise helps us with our higher functioning. So thinking about putting those in a healthcare environment, we do okay. This is an atrium at Mass General, but it is one place that is a part of a larger hospital area, one place that you go to. We think we can learn a little bit more about this from our corporate clients. This is the Amazon Spheres in Seattle, and maybe you've seen them. They were in the media for a while when they opened up. And they have immersed these areas within the fabric of their institution. This happens to be where they do their conferencing, where people go to do heads down work, and there's an area to walk around within the spheres. Also, from our corporate clients, we're learning that technology can be a great overlay in terms of using your devices to impact your workday. This happens to be an app showing down in Lower Manhattan, where you can do a walking meeting. You actually can make a selection for how long, where you can go along the way if you want to stop with a coffee, either with a colleague or with a client. We're also learning and utilizing technology in designing for experience. This is a corporate headquarters for Samsung, where it was very important to them that it was designed in such a way that their staff would be able to see each other, thus be able to think, oh my gosh, I was at a meeting with them, I have something I want to talk to them about, or I read something last night, there they go. If they're within 45 feet, you make that visual connection. Think about what this would mean if we overlaid it in terms of designing an academic medical center campus, where we want that synergy between our clinicians, researchers, students, and even for patients and family to be able to see this. Now, we're using technology today, helping us determine what are the best layouts or designs for some of the facilities we design. What you're seeing right now is an avatar-based digital tool that we use, and we're testing various ways of looking at pre and post-op for procedure space, which ones were shorter travel distances, allowed our clinicians to interact better, maybe less wait time for the patients, and it enables us to make a choice of one scheme over the other. And technology even helps us on a lower fidelity kind of way. One of our consultants talks about it this way, where building mock-ups early on out of cardboard is great for working with our clients. They can get their hands dirty, get in there, really feel like what the size of this patient room is. And technology allows us to link that to our digital model. We don't draw anymore. Everything is done in the computer. Some of us draw, but most of us don't. And it allows us to make a direct connection with sensors so that we understand the impact of those sort of tests that we're doing with the built environment. And then we also have tools that allow us to immerse through the simple iPhone in a device to be able to look through and see and look in a 3D environment, inviting people through the web. Now, we're getting there with technology. This is a client in New York that we're working with that actually made the investment in thinking about really allowing the patient to have complete control through a tablet of what's on the footwall. They can Skype, they can get their entertainment, they can order their meals, they can determine where the blinds are, up and down, they can determine the heating and cooling within their room, they can control the lights. That's a great step of integrating that technology, but it's overlaying it on what we already think about in terms of the chassis in healthcare. And then as we design these facilities, we're thinking about the robots. I mean, they're delivering everything. I'm sure they're all over the Mayo Clinic right now. Should they share the same corridors with humans? Is that okay? Again, we're overlaying this new technology and growing technology over an infrastructure we already have. And is it okay that some of these robots try to look like humans? Is that okay in healthcare? Maybe it is, maybe it isn't. Are those the ones that should share our corridors? We're working through these. And then we're struggling with the impact of technology like driverless cars and new businesses and disruptors like Uber. Right now, a lot of the regulations require us to have so many cars per ambulatory room or patient room. Some cities require that all this parking is underground. Super expensive. Is that going to be something that's going to be in the future or in change? So the reason I'm telling you this is for us as architects, and you've probably all seen a curve like this, similar, the speed of technology change and disruption is continually to increase, but it takes us 2 to 3 to 5 years to design and document a facility and another 3 to 5 years to have it built, possibly 10 years. In the lifetime of changing technology, that is forever. So how do we get around that? And we try to be a little smart. This is, some of my colleagues are out here and they'll recognize this. This is an image from a competition that we did for a future thinking hospital. This is next workstation. We threw a robot in there. We did our best guess at what some of the digital media would be. But that's what we're doing. We're trying to think and get ahead of this technology that is moving so fast. So that brings us to thinking about, we are at a decisive moment right now in terms of designing for technology and the humanness and the connectivity that we want to have. So what we think is that we need to develop a new chassis for how we think about technology in healthcare, not only in terms of the physical, but in terms of the experiential. And here's one example. You're looking down from above at a model of a patient room. And as an example, we think we have to start designing that in terms of components, not just one room, but a kit of parts that can be adapted for as technology changes, and we can overlay that for what needs to happen today and possibly in the future. So working with all of you within your different institutions, the best way where we think that change will be, and it'll enable us to be able to adapt rooms in the future for what that technology may mean and how it impacts the patients in that room. But thinking about the experiential side, we often map the experience of our patients and the clients in our institutions. This happens to be a patient going through a same-day admit for surgery, and we're starting to think about the emotional experience. We're doing it by asking questions now, but as technology and wearables continue, we'll be able to see the impact of that, look at where the tension points are, perhaps center on one, and think about environmentally what we can do to be able to provide a better pathway to the OR, which, when you're awake, is a pretty high anxiety moment. So this idea of experience being another chassis that we have to retool, we were speaking to one of our colleagues who is an experiential digital designer in New York City, and he said he thought in healthcare, it's all about rethinking agency and the patients having agency. So I looked that up. And in terms of societal definition, it is the capacity of individuals to act independently on their own, making free choices. It isn't something we give. Here's 3 choices, choose one. They actually own that. And the closest I can think about that is in this image where you have the agency to decide what you want to look at on the web. If you have a little rash, maybe you'll look at Mayo website, maybe WebMD, maybe look all over the place of the world. You have that agency. I think this is a call to us as we design the experience of people in healthcare, patients, family, clinicians. What agency do they have in the design of these spaces, and especially how they interact with their technology? And we think there's a lot of opportunity. Back to the patient room. What if, as you curate your visit with your clinician, your care team, your social worker, your nutritionist, anybody who works with you in terms of being healthy, and you're on a trial for a cancer drug, how can that room be tooled for you? How can we, as designers, think about how you want to use that room, how you want to have your family interact in that room, providing space where they can be there with you to be able to help you, and you have the agency to help determine what that treatment plan is going to be like, working with the expertise of your care team. And maybe at a point of high stress, you can bring imagery in there that you know is meaningful to you and can help you in that idea of stress. And maybe as technology increases, we can even get a little proactive about what is coming down in terms of AI and what you're thinking and feeling and what that room and space needs to do to adapt to the physical and emotional needs you have at that time as your stay becomes maybe a little more tough. And in the future, to think a little bit about how can that space or the journey to your health be what you think about in your mind and really resonates with you and your family. And not meant to be something like from the holodeck of Star Trek, but how can we embody this kind of feeling and ownership within our design? So I'm going to leave you with 6 thoughts about technology, healing, recovering, and space. First of all, that we know when we design that the virtual connection is going to be the norm throughout a patient's care. That's just going to continue to be critical. We also know that the virtual room, whatever that is going to be as important as the physical room, and technology is going to be a big piece of that. And third, that we have to always remember that we want to balance the ability of technology to be something that's very personal and allows you to do it off on your own, and the isolation that could really come from that, because we need the human connectedness. And then fourth, that the interaction between people and machines will require a whole new design, and that we are really good at designing experiences for patients, staff, clinicians, But we will need different expertise to help us do that as we orchestrate what the best experience is in utilizing that technology. And that a new chassis for this design in terms of both the physical and the emotional and the experiential is going to be critical. Something to think about. Thank you.